one more, which I don't fully understand, to be honest, but it's a game. This maybe gives you also time to reflect on things. How do you know that the starting point in your database in terms of mental health status is consistent?
What do you mean consistent?
I suppose what they mean that it's consistent, meaning that they are fundamentally probably consistently captured in the database, meaning that they haven't already suffered a shock from other.
Yeah, so it's a good point. So we basically so keep in mind two things. One, we start measuring mental health in about 2016. So well before the pandemic, because we wanted to steer away from big changes, being contextual changes. But of course, as you know, we are starting considering mental health of individuals which are collected through a panel at some point in time. So yes, this comment is entirely correct in the sense that mental health at that stage is already the product of something, of experiences, life experiences, something that all these individuals have experienced before. So we don't know what happened to these guys. So we could go back eventually and trace back whether, I don't know, these guys have just suffered from some big changes in their life and account for that when we start measuring their baseline mental health. But one of the reasons why we do matching, so we match treated and controlled individuals before the treatment in wave 8, is precisely to make their baseline mental health level absolutely the same. So we pre-process the data for treated and control groups using also baseline mental health in wave 8. So we start using a weighted group of individuals, so weighted using the weights produced by matching, okay, that essentially impose that mental health is the same between individuals in the treated and control group. So we don't really, in a sense, this allows us not to care too much about what happened before, because we are imposing in our model that the guys that we use in the treated and control group, they start from the same level of mental health. That's precisely why we use matching, because if we don't do that, yes, you may incur I wouldn't say in the mistake, but in the issue that you can have very different starting points, in your treated and control groups, and you don't want that. But I think the question still is interesting, because we could trace back and see, broadly what happened to these guys even before doing the matching, and to see whether, the potential differences between before matching are actually driven by experiences of these people before our window of observation that we use specifically here. We can do that.